Dr. Derek Hurd is Medical Director for Primary Care for the Phoebe Physicians Group and joins us today to talk about an important topic, which is vaccines. So first of all, just tell us exactly what a vaccine is, what it does.
Well, Ben, vaccines are there to help your body fight off infections, and they do so because they introduce your body to a less harmful version of the bacteria or virus that we're trying to get rid of. And so it may take the form of the DNA or the RNA of the virus. It may be the coating of the virus, or it may even be the virus itself, but it's weakened or dead. But because of that, your body's introduction to that antigen, what we call the antigen, it allows your body to have an early warning system. I think the thing that people get confused about with vaccines, they think that vaccines are like antibiotics, that they actually kill the infection, and that's not true. The vaccines are actually there to give your body exposure to this particular antigen so that when it comes in contact with it later on in life, it can recognize it more easily, and then it can mount the immune response a little bit faster.
To fight it off. How can we be sure that vaccines are safe and effective?
Well, Ben, vaccines are safe and effective because just like most medications in this country, they go through a long and rigorous process before they're brought to market. They're tested on tens of thousands of patients throughout this country before they're even allowed to come to market. So we know that they've been tested in multiple human beings. We know then that they are safe and effective. Now, as with anything, there's nothing that's 100%. So I like to tell my patients, I can never say that you won't have a reaction to a vaccine, but here's the important thing. You are less likely to get sick from the vaccine than you would if you were exposed to the actual virus or bacteria that we're trying to ward off.
There's been a resurgence of measles cases because of reduction in vaccination rates. The measles vaccine really is the perfect example, isn't it, of the benefits of vaccines and how they can work? Yes.
Back in the 30s, 40s, measles was rampant in this country, and it's very highly communicable, and so it was easy to be spread. So you could get illnesses such as pneumonia, diarrhea, ear infections, and a lot of times that would cause you to have to go into the hospital. You could get even more serious infections like encephalitis. Encephalitis is an inflammation of the brain that led to problems with loss of hearing, loss of vision, and sometimes even death. The measles vaccine was a perfect vaccine because, again, it was widely tested, was found to be very safe, and because we had such a high uptake in the use of the measles vaccine in the 60s, we were able to eradicate measles in this country over 25 years ago. Now, measles still existed in other parts of the world, but in this country it was eradicated. But because of the last few years, because of misinformation, because of vaccine hesitancy, we've started to see the rates of vaccinations go down in our children. And because of that, we're starting to now see these what we call wild outbreaks of measles, one of which right now is going on in Texas. Right. Yeah.
So who should get a measles vaccine? And if you weren't vaccinated as a child, is it ever too late?
It's never too late to get vaccinated, but the thing I would like to tell everyone is that you should talk to a healthcare provider before you think about getting vaccinated. Either your primary care doctor or go to the health department, and they can talk to you about whether or not you should be vaccinated. Most people born before the 1960s more than likely have natural immunity to measles vaccine at this point measles at this point because it was so widely spread in that age group. If you were born in the 60s, you may or may not want to be vaccinated because one of the early formulations of the vaccine was only given as a one-time dose, and it was an attenuated or live virus that had been weakened. And so the immune response wasn't quite as great in those people. And so if those people are in an area where the virus is in an outbreak like in Texas, then they may want to consider getting vaccinated again. And those who are immunocompromised, if you're immunocompromised because of medications or because of infections such as HIV, you may want to talk to your provider to see if getting the vaccine is the right thing to do.
How important is it for parents to make sure their children get all the recommended vaccines?
It's important because, again, these are a lot of times diseases that can be easily treated or not have your child exposed to at all. yes, we could take the stance that we're going to allow our kids to just naturally catch a virus or bacteria and hope that their immune system can fight it off. But I think it would be prudent to give your child every opportunity to fight off that disease that it can, because although your neighbor's child may have only gotten an ear infection, your child might be the one that gets encephalitis. And so why would we want to take that chance? The example I give is wearing your seatbelt. We never know if we're going to get into a car accident when we go out on the street driving. But I want to give myself the best chance to survive if I were to get in an accident by wearing my seatbelt. And that's what the vaccines represent. It gives your body the best chance that it can to fight off any particular virus or bacteria that it may come in contact with.
And are there vaccines that adults need to be aware of?
Oh gosh, yes, certainly. In the past, we used to think that vaccines were only for kids, but we know that as we age, our immune system starts to wane and go down some. So we recommend as you get older, into your 50s and 60s, you should worry about getting the pneumonia vaccine, RSV, shingles, Tdap. Flu is every year, and COVID is more likely going to be every year. So these are vaccines that adults should be talking to their providers about as well.
And finally, just what is your main message to people who may be skeptical about vaccines?
Well, Ben, I will say that there's a lot of misinformation that's out right now about vaccines. But vaccines have been around since the 1700s. We first started with smallpox. So we know that the science behind that is widely held across the world as being sound. And one thing I wouldn't want to do is risk my family member getting a serious illness because I was afraid of getting a vaccine.
Great advice. Appreciate you being here today.
Thanks, man.